I have a very uplifting topic, the dreaded one-day stays. And if you're a hospital, you know what RACs go after. They go after the big ticket items. And what is that? Inpatient admissions. And if retroactive claims denials wasn't bad enough, then Ohio is selected for recovery audit prepayment review. So that means they can pen the claims before they're even paid. And that's a bigger drain on hospitals. Ohio was one of the most heavily volumed one-day stays. Now, are the guidelines on one-day stay or inpatient admissions that clear? Not really. I'm going to read to you the definition of an inpatient. It's a patient that is formally admitted to the bed with an expectation that they're going to remain overnight, even though it later develops they can be discharged or transferred. That is from the Medicare Benefits Policy Manual. So what do they look at? They have a benchmark for physicians, it's 24 hours, and then they look at certain factors, you know, the intensity of services, the severity of the condition of the patient, whether there's a medical probability that something bad might happen to the patient if they were discharged early. Then you've got the Medicare Program Integrity Manual. Just by the sound of it, you know it's bad. That is what the reviewer is looking at, and the reviewer is supposed to use a screening criteria, and many of them use Interqual or Milliman. And they also look at factors, and they look at, you know, the severity of symptoms and the intensity of services. They look at things like, you know, in addition to Interqual, you know, the inpatient-only list and national coverage decisions. And in the end, it doesn't matter. They deny the claim. And then what are your choices? Well, you can appeal. And if you appeal, it's your documentation. You have to make sure that your documentation meets those criteria from the claims manual, from the benefits manual, and the Medicare Integrity Manual. One of the things you'll want to put in your appeal is a physician statement. The attending physician tells the, you know, ALJ why that patient should have been admitted. But if all else fails, think about Part B payment. Part B payment is the outpatient payment. CMS is not offsetting medically necessary outpatient reimbursement against the inpatient DRG. And what you'll see, and AHA, in fact, has sued them over this, and what you'll see is a trend at the Medicare Appeals Council and the ALJ level where they are saying, okay, you're not going to pay the inpatient claim, we get that. They didn't meet the intensity of service, but there were medically necessary services rendered. So you're going to offset those against the DRG payment. Now, what has CMS done in response to that? Well, they issued a memorandum that says, okay, you know, you, MAC, the Medicare Administrative Contractor, will conduct and secure a new payment. Now, they're not going to allow observation to be paid unless the ALJ specifically says that observation should be paid. So when you appeal, make sure you get that in the ALJ's decision. And then what they're saying is that the provider has to submit a new claim. And if you don't submit a new claim, there's a note here. If the contractor does not receive a replacement claim for the provider within 180 days, consider the case closed. So, you know, if they don't contact you, make sure you pursue the FI, the administrative contractor, to make sure you get your claim, submit the claim, and get your Part B payment. Be proactive. You know, if you're thinking that, you know, you have a one-day stay or a short stay problem, do an audit. Do an audit and offset yourself against the inpatient DRG, the Part B payment, and then send in your refund and, you know, beat the rack to the punch so that you make sure you get that OPPS payment without having to appeal. If you are appealing, make sure you add the Part B argument to all of your appeals. You know, monitor websites like the Pepper report, the CERT reports, the GAO reports. Look at what's happening. Look at what type of one-day stays they're going after. I mean, obviously cardiovascular is very popular. Keep an eye on that and try to figure out if you have a problem. And finally, educate your staff. One word, documentation. That's what you're going to need to win your appeal. Make sure your physicians understand it. Make sure your medical record has what you need for success on an appeal. And that's it. Thank you.